The way I found this case was I worked with a doctor for a couple of weeks, and at the end I asked him, "Have you seen any interesting cases that you're willing to share with me?" And he said, I'll send you a couple." And basically, what made this case was unique was this was a patient that had a history of depression and bipolar disorder, and he was seeing his primary care doc, but they actually realized that it was caused by cancer. So the cancer was spreading to his brain, and certain cancers can have inflammatory processes which damage the brain material, and his damage was presenting as bipolar and depression. And so that's what made it unique. As a clinician, you have to be able to think about depression and other types of symptoms coming from cancer. So lupus most commonly presents in, the studies show, African American women, but it also commonly presents in minority women. And it's, in terms of autoimmune diseases, it is kind of one of the more common ones, but it's also not that commonly seen, just in the general population in terms of just pathology or things that we hear day to day. Well, so lupus is an inflammatory process that basically your cells are depositing complex. So we have this thing called complex, which is when your immune system wants to attack a bacteria or something invading the body, it uses protein complexes to attack them. But with lupus, it's an autoimmune, meaning your immune system is attacking your own body because these complexes are deposited in healthy tissue. Usually you want these complexes to be deposited on bacteria or viruses that are attacking the body. So because it's deposited in healthy tissue, we're saying the lungs, the heart, the skin, the kidneys, we start to have symptoms. In terms of getting into medical school is extremely competitive, and the scores are pretty high for the school in terms of MCAT scores. But also, it's not just about scores, it's about volunteering, it's about doing research and just, bolstering the medical field. I think USF has done a great job in terms of advising me on my career. They teach me about specialties and help me advise my choices with specialties, and I think it's really helpful. I do think we'll see it more often, that we'll see student-led clinics, mainly because it's just a great learning experience for students. And also, our healthcare system unfortunately has an access problem, and sometimes there's just not enough, there's a shortage of physicians, and by using students we can help them learn and also help that access problem. We don't want to give students tasks that they're not qualified to perform. By no means do we want to worsen health outcomes or give tasks to students that can't handle them, but we do want to enrich the learning experience and enrich patient care and outcomes. Medical school is 4 years before you're a doctor. And so I'm about to begin my third year. I start in 1 week from now. So basically, after you become a doctor, you match residency in your chosen specialty, whether it's being surgery, any type of surgical subspecialty, or a primary care. We're talking about family medicine, the family med doc you may have seen growing up, or internal medicine, a doctor you'll see at the hospital, or a pediatrician that you may have had growing up as well. One of my key interests is going back to Miami and working in North Miami. My mom is Haitian, and I have a Haitian background. So North Miami has a high Haitian population, and I would love to go back there and work with my population, with that population, and help reduce disparities. Mainly being an access problem. There's just not enough doctors in that area, or not enough physicians that can provide specialized care. White coat happens maybe a third of the way into your first year. It depends on medical schools. Some medical schools don't give you your white coat until after you finish your second year. Some don't do it until the beginning of your second year. It depends. But at USF, they give it to you after your first test, first year. So we were there. We get to bring our family, and it's a whole ceremony where we get to talk about what are the expectations for us to be a doctor, and they also congratulate us on the hard work we've done so far. And it's really nice because you get to see your whole family, and all your support system is to see you put on this white coat and join a specialty or join a profession that is really, really, really. Sure. So even though I did say it's getting more competitive, and that is true, there's always room for you as a unique student to carve out your own path and to bolster your own story. there's a lot of there's I would say choose one thing. Well, one of my friends he says own your own story. So choose the one thing that you really wanted to things that you really enjoy, and just maximize that, right? So for an example, some people really enjoy research and they do tons of research, and they're kind of the research applicant. Whereas some people really care about diversity and cultural competence. So they've done like different forms of dance, or they've traveled to different places and been with the population. That's an amazing contribution to medicine in the field as well. So own that. So I would just say own your own story, and just continue to believe in yourself.